addressing the specific reasons why psychiatric judgments and predictions are unreliable and invalid. Innes and Litwack write, "It has been suggested that psychiatrists are prone to diagnose mental illness and to perceive symptoms in ambiguous behavior because they are trained in medical school that it is safer to suspect illness and be wrong than to reject illness and be wrong." In other words, being a mental health professional may constitute a set to perceive mental illness. In a study of pseudo-patients, 8 sane individuals feigning one symptom of schizophrenia were admitted to various mental hospitals with that diagnosis. Rosenhan found that even though immediately after admission, the pseudo-patients ceased displaying that symptom and behaved normally, once a person is designated abnormal, all of his other behaviors and characteristics are colored by that label. Indeed, that label is so powerful that many of the pseudo-patients' normal behaviors were overlooked entirely or profoundly misinterpreted. For example, when several of the pseudo-patients took notes of their experiences, that activity was noted in 3 of their records as an aspect of their pathological behavior. There is considerable evidence that psychiatric judgments are strongly influenced by the socioeconomic backgrounds of the clinician and patient. Phillips and Dragons reviewed the literature from 1966 to 1969 and concluded, across socioeconomic or other subcultural lines, the middle-class diagnostician is prone to assign categories of severe psychopathology. In a controlled experiment, Lee and Timmerland found that a lower socioeconomic history biased diagnosis toward greater illness and poorer prognosis. Similarly, according to studies conducted by Ordway, clinicians may be influenced to conclude that lower socioeconomic class individuals are dangerous because such individuals are presumed to be impulsive and therefore more prone to violence. The factor which may most influence diagnosis is the clinician's own personality, value system, self-image, personal preferences, and attitudes. Raines and Rohrer, in a study of psychiatric predictions of combat officer candidate success, concluded that the psychiatric decision involves not only the psychiatrist's emotional problems and defenses, but also his entire value system and probably his self-image. In a follow-up study, the same authors discovered that psychiatrists' observations and perceptions of their patients tend to reflect their own personality structures and problems. Citing Gross and Grossman, the possibility exists that such judgments are less informative about the patient whom they are meant to describe than about the clinician who makes them. Braginski and Braginski suggest a possible context in which the psychiatrist might develop a dislike for a patient. Their studies show that mental health professionals view patients who express radical political views as more disturbed than patients who voice the same psychiatric complaints but whose political views are more conventional. And the following is arguably even more disturbing for a class of professionals which claims it keeps their biases in check. They also discovered that voicing criticisms of the mental health profession, whether from a radical or conservative perspective, may substantially increase a patient's psychopathology in the eyes of mental health professionals, while flattering the profession tends to decrease a patient's otherwise perceived symptomatology. Addressing how predictions of dangerousness are of such limited validity, Innes and Litwack write, "Unlike the task of formulating a diagnosis, psychiatrists are not even trained in the assessment or prediction of dangerousness. Even if psychiatrists could accurately determine which persons are mentally ill, that determination would not assist them in predicting dangerousness because, as has been previously noted, there is no correlation between mental illness and dangerous behavior. To the contrary, the mentally ill may even be less dangerous than the population as a whole. Yet judges, juries, and it would seem the American population as a whole have and continue to defer to psychiatric judgments of dangerousness anyway."